Financial year 2024-25, Butabika National Referral Hospital asked for a budget of 21.22 billion shillings, which was warranted 100% by the Minister for Finance. On utilization of government warrants, the hospital received 8.9 billion shillings for 14 outputs of 72 activities. The auditor, however, notes that a total of 36 activities were fully quantified, with the remaining 36 not appropriately quantified. The hospital also delayed to submit quarterly reports for 3 months during the year under review.
36 you did have. That means if this is 8 billion, 4 point around 4 billion is not accounted for. This is what it implies.
You quantify in the PBS
because the quarterly reports, like you said, they are important to take decisions and to monitor your performance.
It's an administrative mistake, and it communicates a lot. Number one, within the system yourselves, this is a sign of inaccuracies, incompetence, and some administrative flouts.
The Executive Director, Butabika, Dr. Gorretti Namugga, told the committee that cases of mental health have increased by 70%, with the adults standing at 24.2%, while children at 22%, attributing this trend to multiple causes.
Especially when you talk about young people, we have children. Maybe at this point in time, we begin to get to know how to begin, planning and managing them. So I'm interested in trying to understand the causes of this increment, because it's really worrying.
We have been here before, Honorable Chair, to talk about the school programs that do not allow young people to rest enough. There's prep starting at 4 a.m. and the child has slept at 11, then they are up at 4 a.m. to go to class. We've talked about these things here before. So those things cause a lot of academic stress, but including the expectations.
The Auditor General's report on management of works in the hospital shows that nurse-to-patient ratio were below standards. Members of Parliament squeezed officials of the status of the private ward, shortage of essential medicine and overstayed patients.
As high as the nurse-to-patient ratio is at 1 to 79, and you told us it was supposed to be 1 to 30, 1 to 10. 1 to 10, or to 15. So for at Butabika, one nurse handles 79 patients.
The private wing, at any one time, we have more than 60 patients admitted in that wing. And we have more than one wing. So each of those is staffed on average on any one day with at least 4 nurses. So it is, but they're part-time. Being promised some additional funding for next financial year of 18.9 billion on top of our budget to close some of these gaps, including equipment, including wage, including medicines, support supervision to the...
On the gaps in the delivery of community-based services and post-treatment services, Dr. Namugga expressed a need for government-wide system to follow up patients who have been discharged.
The system needs support to be able to support this. So when we refer people back to the communities, the district hospitals should be able to pick those people up and document them as follow-up. So that
of your definition of a community here is those referral hospitals becomes your community where you do the follow-ups with. And if you cannot be able to demonstrate that 5,000 who are discharged, they are just up in the air because they're coming from where? Can we say that many who are dying out of this in the community is just because of your failure to follow them up?
We have an outpatients clinic that follows up patients who are discharged, but it is only for people who are within the radius of the hospital.
With a high bed capacity rate at 160%, Butabika has a bed capacity of 550. It, however, accommodates 1,200 patients. Dr. Namugga says they hope to address this congestion in 3 years and scale down to at least 650 patients. I'm Navka Farida and Gloria Butabinji at Parliament.